how do we make sure that medication doesn't just become another failed diet? How do we think about that person holistically?
And whilst the medications are great, there's no doubt that the most durable, best weight loss is with surgery.
Looking at the medic. So I think
I'm Guy Slater, Chief Medical Officer for Roxy+Rex. For today's episode of this podcast series, I'm joined by the experts who took part in the previous 3 episodes, Shaw Summers, Eveleigh Nicholson and Mel Rendall. For those listeners who didn't see the previous podcast, maybe you could introduce yourselves, starting ladies first with Mel.
Thanks, Guy. So my name's Mel Rendall. I'm a clinical health psychologist and I've worked in both the NHS and private sector for about 20 years now, and I've always been very passionate about working with people adjusting to long-term health conditions, and I've got a particular interest in supporting people with their relationship with food, weight and bariatric surgery.
Brilliant. Eveleigh.
Yeah, so Eveleigh Nicholson, I'm a predominantly NHS-based consultant in diabetes and endocrinology. And within that, I have a specialist interest in helping people living with obesity and also around bariatric surgery, so helping people with the medical side of things, both pre and post-surgery.
Brilliant. And last but not least, Shaw Summers.
Hi, I'm Shaw Summers. I'm a specialist bariatric and upper GI surgeon. Been working in the NHS for the last 40 years. And was one of the first to start an NHS service for weight loss surgery back in the 90s, and have seen the evolution of this subject from what was a very rare operation into something that is done every week in the NHS.
So in the previous episodes, we went through all the different causes of obesity, their treatment and psychology and so forth. So for those listeners who haven't heard those earlier episodes, maybe we could summarise. So starting with Eveleigh, how does obesity occur?
Yeah, so we talked in previous episodes about how complex obesity is from a biology point of view. We've got lots of hormones in our body that all work with each other to maintain somebody's weight. We've got hormones that drive hunger. We've got hormones that tell us when we're full and don't need to eat. And there's also other hormone systems that contribute to that, like our thyroid hormone and our sex hormones. And then there's also, we talked about genetics, about how our genes might influence the types of food we like to eat, how full they make us feel, how our bodies respond to dieting, where our body lays fat down on us. So there's lots of different biological influences that affect our weight.
And then I think Mel, you spoke to us about how that interplays with psychology.
Absolutely. So like we know, medications undeniably massively impact on biology, often giving people a bit of breathing space where they can step back from sort of feeling like they're in constant kind of fight or battle with their appetite and their relationship with food. I think psychologically this is so key. It's often the starting point for people to be a lot more compassionate to the struggles that they've had over years, perhaps reducing some of the shame that comes with this. But as we've said, although these medications can nudge people towards different behaviours, they don't necessarily change the complex relationship that we've had with food from our childhood, perhaps different traumas we've gone through in life, when we're pulled out of our kind of usual eating and exercise routines, when we're under chronic stress. So it is about thinking about the whole picture, I guess, and how do we pair medications perhaps with other kind of things such as psychology to help get the best outcome out of these medications.
Brilliant. And sure, how do you see the treatment pathway?
So in our episode, we talked about how we integrate the knowledge that we've gained from insights that Eveleigh has explained, and how we deal with individual people in their lives, as Mel has explained, and put that into a treatment plan for the individual. It is very much individualized. We have a number of different treatment options of, if you like, different strengths that we can apply to individual patient circumstances. And it's not just driven by the size of the patient, it's driven by what does the person need to actually help them get over their weight problem. And so I'm very keen to make sure that people have all the information they require about the treatment options, and actually are guided by a professional to pick the right one that's going to do something for them.
Okay. So I guess within all those different treatments, there are sort of key messages. Melanie, you were going to say?
No, I was just saying, actually, just listening there, sure, isn't it? I think what's, for me, is key listening to this is, how do we make sure that medication doesn't just become another failed diet? How do we think about that person holistically with their individual kind of biology and set of genes, the kind of life experiences that people have, the way they kind of use food in different ways, and so therefore drawing on a kind of individualized treatment plan, really, and looking at what aspects do we need to support people with, whether it's some psychology or exercise specialists, to really help people get the change that they ultimately want out of this.
I mean, for me, the first step whenever I discuss weight issues with a patient is helping them understand that it's a proper disorder. It's not just a choice they've made to eat too much, but this is a disorder of their regulation. I mean, would you agree with that?
Yeah, so we've talked about in the previous episode, I said, we know we've identified more genes associated with obesity than we have with blood pressure, and we certainly don't assign blame to people for having high blood pressure, so why would we for weight? So yeah, it's about that holistic view, isn't it, to the whole individual, and what are the different elements you can add in and change to add up to the change. And no one intervention is likely, no one thing by itself is likely to make that change, but how can you tweak lots of things? The whole theories of marginal gains, isn't it? How do you make all those little changes add up to a big difference? And I think that's what anyone who's lived with being overweight, and most people we see have lived with being overweight for often decades, have often tried diets and tried things like that, and they've not worked. It's about understanding why perhaps it hasn't worked, and all those things that can then change to add together to shift where their weight is.
I think it's also partly helping them understand that there are different strength treatments, if you like, from medications to minimal interventions to surgery, and they're part of a spectrum to help them overcome their disorder over a lifetime, because if we could switch it off and cure it, that would be great, but the reality is we can't. And what we've got to help people understand is that actually this is going to be a lifelong change, not necessarily a struggle, but a change, and that if they can adapt and use a succession of treatments that are designed to help them, they can actually achieve at least a significant weight loss. It might not be back to normal, but it would certainly be a lot better than the position that they find themselves in.
And I think also perhaps focusing less on the weight loss as the absolute goal, about making people, it's not about making people thin, and certainly not necessarily making them happy, but making them fitter and more functional. And also, I think, helping people recognise what that means, because I do think people worry about, the absolute numbers, and actually the aim for any of us working in healthcare is to make people fitter and more functional in their day-to-day lives, rather than an absolute number that they have to get to.
And I've seen that over the years, that people chase a number and they go, well, I've got to get, when I was 21, I was X number of kilos. And you go, you're asking a tall order.
Also, one of the most difficult things, isn't it, to, these are people that have been socialized through years of dieting into that, relationship between self-worth equals weight on a scale, and undoing that is not easy at all.
But there are so many myths that we have to bust now. It's almost like we don't want to be seen as the sort of people throwing the damp towel on calorie counting and stuff like that. Calorie counting is useful, but it's not the tool that's going to make you better. And we have to understand that modern science has told us that actually it's not just the calories, it's how they're presented when you eat them, how you're feeling when you eat them. All of those things change what those calories actually do to the body. So it's about eating good food, having the right environment, the right changes in place, and then, if necessary, the right treatment. And that is very difficult to organise by yourself, just by looking at the internet. And what I have to spend a lot of time is actually debunking patients when they come to me and say, you know, how do I lose these last 4 stones? It's about actually accepting that you need a bit of guidance with this. You will be able to do a lot of it yourself, but you need to be pointed in the right direction if you really want to get somewhere. Is that what you found looking at patients, Guy?
Yes, I think so. I suppose I am a little concerned about the concept of calorie counting at all.
Yeah.
Whilst losing weight is clearly about reducing calories in terms of energy input, the idea that we can accurately measure the number of calories in one food to another is wildly wrong. We all consume foods differently, we all metabolize them differently, we take different amounts of calories from them. And then similarly, when you balance that against calorie expenditure, we're also massively different. So I think calorie counting is really very difficult.
I suppose it's interesting because it makes me think about, I suppose one of the ways when I'm discussing these sorts of things with people I work with, I suppose I don't look upon these things necessarily as being good or bad. It's how helpful or unhelpful, isn't it? And when we think about diet mindset, I try and help people to really step back and think, okay, so what is it around your experience of diets over the years that's been useful that we could take with you on your medication journey in terms of sort of developing a much more flexible relationship with food? And then what is less helpful. So if calorie counting is quite not too rigid and it's quite loose and it's a way of self-monitoring and checking in and holding someone accountable, then that can be a really useful thing in terms of helping people kind of make the changes. But if it becomes what we know so often happens, it's very rigid, people can then easily get pulled back into that fighting, with food, fighting with their weight, weighing themselves constantly, and things can go pear-shaped.
Good. Where do we think exercise fits into managing weight, losing weight?
Yeah, we've touched on exercise before. So we know, exercise is important for lots of reasons. It's important for your bone health. It's important for your muscle health. It's important for your mental health. It's not terribly good for achieving weight loss. Now, there will always be some people, because we're all made differently, for whom, weight loss can be achieved through exercise. But the reality is, when you exercise, we always overestimate how many calories we burn when we exercise. And exercise is often a trigger for hunger. So people tend to eat more when they've exercised. So it's not a great way to lose weight. Plenty of evidence that says it is, however, really useful for maintaining weight loss. So again, it's part of that bigger picture of the things you need to add in. And exercise doesn't have to be Lycra. It doesn't have to be gyms and expensive memberships. It's anything that makes you a bit out of breath and a bit sweaty. And as Shaw's talked about debunking myths, I think that's one of them, that exercise has to involve equipment and fancy matching outfits and, videoing yourself doing your workout. And it doesn't have to be any of those things. It can be free and easy, and it can be done in your own home in a chair if it needs to be. And that's all part of the education piece about helping people recognise there are things that they can do and add in that are achievable that will help.
Okay. So whatever journey people choose to go on in terms of their treatment, I think the actual foods you eat and taking exercise is key.
Absolutely. I mean, I bang on about this again and again with people I work with. I think for me, it is about debunking myths about exercise and understanding that it's about, maintaining weight. But, when you stop and ask people, okay, so you want weight loss, you want to be healthier, what will I see you doing if you achieve that? Everyone very quickly goes into, I guess, values, what really matters to them. They want to be a better parent. They want to feel like they're more engaged with the people that they love. They want to be out there being more active. And of course, all these things involve, the body's ability to move. So, again, I think drumming home the exercise component is so key and is probably the most potent thing that we can add in biologically, physiologically.
If you could prescribe exercise,
Absolutely.
It would be one of the most powerful medicines that we
Absolutely.
have. I tend to call it activity rather than exercise, because you do see some people glaze over when you go exercise. Oh, yeah, I've been there, I've done the gym. Activity, so it's 2 brisk walks a day, round the block, whatever, that just gets you a little bit out of puff. Even if it's 2 times 15 minutes, it's better than just sitting on scrolling on your computer all the time. And then I think the other thing, from my point of view, that's become much clearer to me over the last 10-15 years is quality of sleep. I think a lot of people have terrible quality sleep because they're up till late online, texting, doom scrolling. And if your sleep is no good and you wake up tired, you will become more hungry. Your ability to go, no, today I'm going to behave like this and I'm going to stick to the diet and go for my walks, is eroded because you're tired. You don't want to do it. And I think sleep hygiene is really important. If you're going to do a proper weight loss pathway, if your goal is to be lighter, more functional, have a better quality of life, then you've got to get your sleep in order, as well as all the other things that we want to discuss. Because if you don't sleep properly, doesn't matter what we do, it's going to be a really tough journey.
Absolutely, but it's the whole package, isn't it? We've used a lot of car analogies in our discussions, I think, over the episodes, and I think it is, when we think about our car, isn't it? We've got to do a regular MOT. How is our sleep? How connected are we to the things that are important to life? What stresses are we under right now? Are there other ways that we can do to better manage those? So that's that sort of monitoring aspect, isn't it? Kind of, again, realizing that it's not just your genes, it's also the whole picture, and keeping an eye on that and getting the relevant support you need.
So even if we struggle with our weight, if we eat well, sleep well, exercise well, most people it's not going to give them that long-term sustained weight loss. So where do we see the next step for people struggling with their weight?
Well, obviously we've seen particularly in the last 10 years, the emergence of really effective weight loss medications. 20, 30 years ago, there were very few options for people beyond, if you like, the sort of traditional standard advice of eat less, move more, which is what we tended to revert to. But weight loss medication, it's giving people options, and that's what most people want and need, is just, that menu of things, if you want to use a food analogy, menu of things to be able to choose from that fits their lifestyle, that fits their psychology, that fits their needs. And the weight loss medications, of which, there are 3 main ones currently available, are now offering up to 20% plus total body weight loss, which is, far beyond anything you tend to see sustained and long-term from diet, because they work differently. They mimic the hormones that are naturally there. They offer that sustained and sustainable weight loss. And I think that's the thing with things like diets, is they shift your biology so that your body works against you. Diets make you hungry. They make you seek food. And when you change your biological environment through medication or surgery, you get rid of those things. So your body's no longer fighting against what you're trying to achieve. It's working with you. So I think medication has just become another tool that we can now use alongside those other things you've mentioned to really help people, as you said, not just lose the weight, but then keep it off in a way that is truly sustainable.
Okay. One of my concerns with medication, and exactly as Mel touched on earlier, we're so obsessed with weight. I'm concerned that people will just use medication to get to their magic weight target and forget everything else. Anyone else share those concerns?
Absolutely, because we see again and again, or I certainly do, it's not that goals are bad, but of course most people have this idea, well, once I reach 11, 12, then I'll be happy, and then of course what happens when we get to this goal, it shifts, isn't it? So, I think this is key, helping people, and this is a large proportion of what I guess we do psychologically. We help people just kind of disentangle from that self-worth and weight, kind of just being able to kind of have a bit of a broader recognition of what constitutes success, not that sort of learn judging themselves as, a weight on a scale, which of course is so difficult because that's the messages that they've often been given, sometimes going back to, early childhood.
Okay, so if we had a friend who's considering medication, what advice would each of us give them based on our sort of knowledge?
So I think, for me, it'd be the simple things like recognizing that weight loss medication targets one area, but the quality of your food and the quantity of food is important. So things like taking a multivitamin, if you're going to go for weight loss medication, I think is important. And exercise. The multivitamin and the exercise are the things that I would really focus on if it was a friend, to make sure that they weren't pinning all of their hopes on just this an injection achieving everything, as you said, everything they've wrapped up in that weight loss, in achieving that.
Psychologically?
Yeah, I really just echo what Eveleigh say. I think these things are tools, right? They're not a panacea. Nothing is a cure, whether we're looking at surgery or medications. As we've talked about in other episodes, I think these medications can give that breathing space. I think once people can step back with this lifelong tug of war battle they've had with food, there is an ability, arguably, to have a little bit more choice over I don't know what kind of food types they have, how they eat. But again, medication doesn't nudge people into those habit changes. So it's also just being aware of what are some of the drivers that make you eat, what are some of the ways you cope with emotions, what other tools do I need to gather here to help me work as well as possible and as sustainable as possible with the medications.
So what would I do with a friend who would like to lose some weight? I mean, I think the most important thing is to understand what their goals are, how much weight do they want to lose, why, and what is going to success look like for them. And then try and match up the treatments that are available, whether that's in just lifestyle change and diet, because that's maybe all that's required, because they may be drinking too much alcohol, eating too many sweet foods, etc. And they're very simple things to just switch off, because you can just switch those off. And then going through medications, and if medications are chosen, what do you do when the medications stop? So you either commit to taking these in the longer term, with breaks if necessary, but in the longer term, or you take them to achieve a goal and then say, well, when they stop, how are we going to try and maintain that body weight, or are you going to need repeated courses? And generally, you can make an educated judgment for the individual whether one of those scenarios is going to be more likely than the other. And then for some people, we actually understand that they're going to need the full strength treatment right from the word go. And that's where we start to have the discussion that, well, you could take the injections, but in the end, you're probably going to need something a bit stronger. And by a bit stronger, we mean surgery. And whilst the medications are great, there's no doubt that the most durable, best weight loss is with surgery.
Looking at the medic. So I think, in a perfect world, people would be able to sort of flip-flop between everything. You'd have the psychological support, the dietetic support, the lifestyle change, the exercise. Particularly people, as Shora said, obesity is a chronic disease. You don't cure it and walk away from it with nothing. It requires lifelong treatment. So if you're starting treatment in your 30s, you're right, you might not be able to afford to or want to be on medication forever. But in an ideal world, you'd want people to have that choice of, you'd have a period of time on medication, and then you might have a point in your life where actually you need to consider surgery and you might need surgical intervention, but then be able to go back to medication at a later date and be able to move between those options without having to commit to just one. And that's obviously where, from a healthcare perspective, from a National Health Service point of view, that's difficult because we don't necessarily have all those options. We can't necessarily do that. And that might mean, making choices that perhaps aren't perfect, but are the best option in that circumstance.
Can I ask, what I'm not sure of is, how long do you expect repeated courses of injectable GLP-1s, for instance, or their oral analogues, to keep working? So if you've been on them for, let's say, 10 years, because they've only just been out, will they keep working, or are you going to need to go, do you know what, this one's worn out?
Yeah, I think that, so in honesty, I think that's difficult to know because they simply haven't been around that long or long enough for us to make that judgment. Can I say with absolute honesty that the evidence exists that you could take a weight loss medication for 50 years and in that 50 years it would keep working? And we don't know the answer to that. We use some of these medications for type 2 diabetes, and people have been on them, nowadays have been on them 10, 15 years and they are effective. It's difficult to know. We know these medications work for weight loss after weight loss surgery. So we know people can have surgery and go on to these medications and lose weight. So there are hints, but I don't think any of us could say with absolute certainty, yes, someone can be on this medication for 50 years and it will definitely keep working. But that's where new medications and new versions of medications and new therapy interventions, not just medications, but other surgical options, will hopefully, in the coming decades, will just keep opening those options up for us.
My philosophy is always give the patient the information about, for them particularly, what is likely to work, what is going to be, in my view, a waste of time, and what realistic treatment options are going to help them achieve their goal, where they want to get to. And as Mel said, not necessarily going to make you happy, certainly make you lighter than you are now. And through that and the change in your lifestyle, hopefully you'll have a better quality of life. And that should make you happier. And I think it's helping people understand that a lot of oversimplification has emerged on the internet, in social media, that you just do this and it all falls off. Look at me, how successful I've been. It's very interesting that my experience in looking after people who've posted certain things on the internet, that in the end it catches up with them and reality hits home and they need a proper consultation, a proper work through of what is and is not likely to work for them. And I think it's having that professional input at the beginning, a bit of guidance on the pathway, helps them get a more sustainable result with whatever option they choose. But it's them being open to the fact that they're not going to choose this on your own. It's a bit, almost like someone with high blood pressure. They've just been diagnosed, high blood pressure, go to the GP. The GP says, well, it's all on the internet. You choose what tablet you want. Who would do that? And yet people think they can do that for weight loss treatments.
So interesting. I'd like to just stick on that blood pressure analogy for a minute, because as you talked about earlier, people with high blood pressure, we start them on treatment. It mostly controls their blood pressure. We don't have to escalate their treatments necessarily or always add in more treatments. So I don't see why necessarily these drugs would stop working in the longer term. Obviously, we don't know.
Yeah, I think it's just everyone's different, aren't they? And you're right, some people are going to have, and this is where I often think medicine it's not a great science, actually. So much of it is really art, because you can give a tablet for blood pressure, to one person and it controls the blood pressure beautifully, and you give it to another person and they get side effects and it doesn't work at all. It's not consistent. If medicine was a proper science, it would be consistent, and it's not. But you're right, some people, you can have a low dose of one treatment and that's them sorted for the next 40 years. Some people need escalation, some people need different combinations. There are many different classes of drug for blood pressure. Some people we know work better with some combinations, some with another. And as Shaw says, you don't ask that person without any experience to make a judgment call without trying any of them what might be the best one for them. You need that professional input to guide people through, but also recognize when something isn't working and when you need to change. And I think, again, one of the things people find so demoralizing is they keep doing the same thing but expect a different outcome. And that's also not logical.
Then they blame themselves. Well, it's just me then.
Exactly.
Absolutely.
I've not tried enough.
And it's human nature, isn't it? When people encounter a bit of a struggle, whether it's after bariatric surgery or medication, people go back to what they've used before, so they go back into unhelpful, unsustainable sort of diet behaviours. But I think teams come in here, doesn't it? It's a bit like, going back to our lovely car analogy, it's a bit like when that Formula One car comes into a pit stop. You've got everyone running out and they're all kind of doing their own little job, isn't it? It's about the pairing of stuff. And I think about psychology, and I think back in the days of bariatric surgery, it's like, well, maybe we got to shave people away here and treat the binge eating, but actually what we know is yes, we want to make sure people have got some tools to manage their emotional relationship with food prior to perhaps starting medications or surgery. But actually, again, I think the more that we compare the psychological with the benefits people get from surgery and from the the biological changes that come with medications, ultimately the more we can kind of set people up for success, irrespective of how long they're on the medications, set them up for perhaps some better habits for if they have to go off the medications, And I think that's a really important thing.
So maybe we'd recommend to our friend that they had a psychologist, a physician, a dietitian, and a personal trainer.
Yeah, and keep the surgeon out of it for as long as possible, yeah.
I wouldn't disagree with that. I think that's fair, because not everybody needs surgery, and surgery isn't for everyone. So, but as long as it's an option that's there if it's needed, and I think that's where it's been the only really effective thing for about 20, 30 years. And all of a sudden the medication has come along, which is for a huge majority of the patients as good. And I think it's about marrying all the treatment options together for the individual. So, I don't think surgery is now obsolete. I think it still has a place for those who really struggle with severe obesity, with complicated obesity, where you need control quickly and absolutely certainly. And it's about the access of, can you get the meds on the NHS? Well, not yet. And so if you can't get them on the NHS and can't afford them, then surgery might be a better option to get control now. But I wouldn't disagree with you that you keep them away from a surgeon until they really need it.
So that's all we've got time for. I'd like to thank all of you for joining me. It's been an absolute pleasure listening to you, and thank you.